So I want to share a case study with you. This is a patient that I've met about 6 months ago. We started a journey. She was in a motor vehicle accident many years ago that left a lot of scarring. She's done a couple of facial surgeries to, restore the bone and try to bring a little bit of symmetry without a facelift. This was more not cosmetics. This was more of a medical necessity to restore a little bit of balance to her face. But so 20 years later, she feels like the skin, one part of her face, the skin has drooped more. She is not ready for a facelift, a more intense approach to address the concern. Yet she still want to look refreshed. So she found us. She comes in, and like I always say, we customize the plan. So we did she came first, she started with a facial just to, test the waters. I was like, facials is not gonna lift the skin. Facials is not gonna increase volume on the face. It would just give you like a luxury treat to your skin, like a five-star hotel to your skin. Okay. So she didn't understand. She comes back a couple of weeks later. We started with PDO during PDO thread. I did mention to her, according to the recommendation that I gave her, it would be nice to add on a little bit of, appropriate balanced volume to the face. So everything harmonized nicely. We lift the skin, we feel a little indentation under the eyes, we project the chin a little bit, we may feel a little bit of the lips. We do toxins above the max, which is anything from your nose up to the hairline. We do toxins there on the jawline, just to put everything into a nice perspective. So she does that, and you can see the difference from when she came in. Then she comes back a few weeks later for the PDO thread lift. Then 5 months later, she comes in and we add in the lipoderma fat transfer. So just take a look at the transformation and see if you need a similar experience. You're thinking, you're not sure, you don't know where to start from. Come in. She started with a facial. She came in for non-surgical and now fat transfer. And these are all non-surgical, very well pain controlled. You will be comfortable because we make sure that lidocaine is in your skin. You're not going to feel anything much. We also use a cannula. So bruising, not here. And pretty much is between 1 to 2 incision sites. That's about it on each side. That's about it. And so recovery is very minimal compared to going through liposuction, getting your fat, working on the fat and putting it back in your face. You have skipped all that process. You just have the fresh, sterile fat to be implanted under the skin in an